The Christ Hospital has been a leader in heart care since the late 60s, when it performed the first open heart surgery in the region.
When I returned from training in San Francisco and Boston to Cincinnati in 1985, I was inspired by the vision of Carl Lindner, who asked, "Why should I have to go to Houston, Cleveland, or Boston, or anywhere else to get the best heart care?" My answer was, "You don't, Carl. We'll bring it here." And so began an incredible story and a fascinating journey for me, for the Christ Hospital, and for the people of Cincinnati.
The Christ Hospital is also committed to heart disease awareness and research through the impressive work of Dr. Dean Kariakis, who leads our Lindner Research Center. Dr. Kariakis has been a national pioneer in heart care, and we're most proud of his many contributions and the legacy he is building on behalf of the region.
Over the years, I've been fortunate to work with outstanding individuals here, across the nation, and throughout the world. Talented, passionate people who share a common vision and focus on improving patient care.
My colleagues at the Christ Hospital and the Lindner Research Center work tirelessly to create an environment where almost anything is possible. Our achievements are acknowledged nationally and around the world.
We pioneered the first ever bioresorbable polymer metal platform coronary stent, as well as the first ever bioabsorbable coronary stent.
The Christ Hospital and the Lindner Research Center are nationally recognized leaders in pacemaker and implantable cardiac defibrillator device care. The first defibrillator to sense pressures in the heart, and some of the first MRI-compatible pacemakers were given to patients right here at the Christ Hospital.
When doctors Kariakis and Schloss recommend I have a defibrillator implanted, little did I know that years later, while watching my daughter compete in a horse show, it would literally save my life. And thanks to them and my device, I'm able to tell this story. I'm alive today and enjoying life.
You can take all the adult care facilities in the greater Cincinnati region and add them together, and they don't compare to the scope and depth of leading-edge clinical cardiovascular research that's performed through the Lindner Research Center at the Christ Hospital. We currently conduct more clinical cardiovascular research trials than the Cleveland Clinic. The Christ Hospital doctors have earned international credibility through almost 1,000 peer-reviewed scientific publications in medical journals and books. Our doctors provide global physician leadership for many large-scale multi-center trials which involve more than 500 major medical centers worldwide. Our collaborators include organizations like the Harvard Clinical Research Institute and the Cleveland Clinic.
Here at Christ Hospital, we're leading multiple groundbreaking trials. One such trial is a catheter-based treatment for resistant hypertension with renal sympathetic ablation. This treatment is a game changer for patients who have high blood pressure and truly offers new hope to patients.
One of my most rewarding experiences was becoming the international physician leader for the PROSPECT trial, which determined echocardiographic predictors of clinical response to biventricular pacing.
I was honored to be an international physician leader for the pain-free SST trial, which evaluated a novel technology for preventing inappropriate defibrillator shocks.
From clinical research has come better clinical care for patients at Christ Hospital, including programs for disease management such as heart failure.
The Carl and Edith Lindner Heart Failure Treatment Center at the Christ Hospital is a unique 30-bed hospital unit staffed by 4 full-time heart failure specialists, as well as specialized nurse practitioners, pharmacists, and dietitians, and exercise physiologists. The center is a unique resource throughout the entire Midwest.
From our heart failure disease management team was born a new left ventricular assist device program. The Christ Hospital has been recognized by Humana as the first non-transplant hospital in the region to gain coverage for ventricular assist device implantation in heart failure patients. Our program was also recognized in 2012 by Thortec as a gold standard center of excellence, ranking among the top 20% of ventricular device centers nationally for quality and outcome metrics.
I live in Kentucky, and when I was diagnosed with congestive heart failure, the doctors here recommended a VAD. Without the doctors at the Christ Hospital and this device, I wouldn't be here today.
Clinical research gave rise to the Heart Valve Center at the Christ Hospital through participation in the prestigious partner trial of the Edwards Sapien transcatheter aortic valve used in aortic valve replacement without open heart surgery.
I first had open heart surgery when I was 65 years old. I certainly didn't want to go through it again. Now I've got more time to enjoy my family.
Another landmark research achievement was being selected to participate in the prestigious COAPT trial of a mitral valve clip used to repair leaky mitral valves.
The Christ Hospital is the only hospital in Cincinnati to participate in either of these prestigious trials and is one of only 2 hospitals in the entire Ohio, Kentucky, Indiana, West Virginia 4-state region to have both of these leading-edge technologies available to treat patients.
Consistent with our mission, the Christ Hospital has made significant investments. Most recently with a $5 million state-of-the-art hybrid operating room for structural heart and vascular disease, as well as a $4.5 million investment in an advanced EP cath lab to treat atrial fibrillation.
Research has helped the Christ Hospital gain national recognition as a center of excellence for heart attack care.
The Christ Hospital was among the first in the nation to use trans-telephonic transmission of 12 lead EKGs to diagnose heart attack at point of first medical contact in the field. This saves valuable time so that life-saving angioplasty can be performed sooner.
As Ohio's steering committee chairperson for Mission Lifeline, the American Heart Association's national initiative to improve heart attack care, I'm proud that the Christ Hospital is the only Platinum Award recipient from the American College of Cardiology, American Heart Association for performance and quality heart attack care in the greater Cincinnati region.
When patients suffer heart muscle damage from a heart attack, the Lindner Research Center offers comprehensive regenerative medicine, including stem cell, gene, and device therapies.
I literally died from my heart attack in the ambulance. Cincinnati EMS revived me and brought me to the Christ Hospital.
Mark's case illustrates what a heart attack center of excellence can achieve. Knowing every minute was critical, we whisked him through the emergency department and onto the cath lab table. Mark subsequently enrolled in a stem cell research trial while in the hospital and now has completely normal heart function in follow-up.
Here at the Christ Hospital, we've pursued the most advanced technologies for treating atrial fibrillation. Although we have 4 state-of-the-art electrophysiology labs, Room 4 is one of the most technologically advanced in the country.
When I was first diagnosed with AFib, man, I was shocked. But I was fortunate. The technology and the expertise to successfully treat me was right here at the Christ Hospital. Now, I'm back in the game again.
That's how a private community hospital in Cincinnati, Ohio, has become an international force for leading-edge technology and leading clinical cardiovascular research on a global level. The Christ Hospital couples world-class expertise with innovative technology to provide unparalleled patient care.